Angie, and today I'll be performing the written demonstration of the eye assessment, which is important organ of our sense of sight. So reviewing the previous patient's records offers opportunity to get instances of the harm to a patient, and this will allow me to get the basic information about the patient prior to the assessment. Now, I'll be determining the scope of assessment needed and prepare the necessary equipment to ensure organization and increase efficiency during the procedure. The equipment includes the millimeter ruler, the pen light, the Snellen chart, the opaque card, working gloves, jot down notebook, and pen. Now I'll be performing the hand hygiene to deter the spread of microorganisms and don gloves. So now, I will greet the client politely and client's companion if around, introducing myself to the client to enhance rapport and verify the client's identity to ensure the care is being rendered to the correct client, and ask how the client would like to be called during the assessment. So hi, good day sir, how are you today?
I'm fine.
Okay, good. So sir, I am Angeline Pioquinto, your student nurse for today. For the verification, are you Mr. Nonito Serrano?
Yes.
And when is your birthday, sir?
September 21, 2002.
Okay, good. So, sir, what do you want me to call you?
Just call me Nons.
Okay, Mr. Nons. So, I will explain the procedure to the client to reduce client's anxiety and how he or she can participate during the assessment to enhance cooperation. I will provide the client opportunity to ask or raise any concern. So, Mr. Nons, I'll be doing an eye assessment. I'm going to check how clear and how good your eyesight is, and of course check if there are certain spots or angles at which you have trouble seeing. Okay, so during the conduct of the assessment, I might need to ask you to stand up, to sit down, and to read something or shine a light in your eyes, and all the results will be documented, but it will be all kept confidential. Will that be alright, Mr. Nons?
Yes.
Okay, so do you have any clarification or questions, sir?
No.
Okay, sir. Thank you. So now I'll be ensuring the client's comfort, privacy, and confidentiality by closing the door, closing the windows, adjusting the room temperature, and provided the adequate lighting. Then the assessment setting should be assured to be safe, secured, free from distractions, and position the client to be seated comfortably, since proper positioning facilitates client's comfort and efficiency in performing the assessment. So let's begin. So as I can see, you are using your graded glasses. So let's begin, sir.
Yes.
Have the client stand 20 feet from the Snellen chart, cover the eye being tested, and ask him to read each line until he cannot decipher the letters or their direction. So sir, I'm going to have to ask you to stand up. Okay, sir. So what I need you to do is to use this opaque card to cover your right eye and read the letters that are written in this Snellen chart, and then just up until the letters that you could still see. Okay, then next is your left eye. So then after doing the right eye and left eye, for the third part of the procedure, I need you to read the letters with your both eyes uncovered. Okay, sir? Sir, here's your opaque card.
E, F, T, C, U, Z, L, F, A, D, E, E, C, F, D, A, D, F, C, Z, E, ECFD, EDFCGP, FLUFGD, TEFEUTG, D,
Okay, so your both eyes are uncovered.
EFETUZ, out EED, PECFD, EDFCGP, FELUFGD, DEFFOETC. Out.
Okay, sir. So, that's good. Thank you. You can sit back, sir. So, perform selective vision test. The light perception, hand movements, then counting fingers if necessary if the client is unable to see even the top line of the Snellen type chart. So, sir, I need you to tell me how many fingers I am raising, okay? So, sir?
1, 2, 4, 3.
Okay, sir. So, I need you to tell me what direction I am pointing my finger. Sir?
Left, right, down, up.
Okay, sir. Thank you. So, sir, I need you to tell me if you could see the light, okay? Can you see it?
Yes, 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 yes.
Okay, thank you. So now in the visual fields, face the patient directly at a distance of 60 to 90 centimeter. Instructed the client to look directly at the examiner's eyes with both eyes. So sir, can you look at directly to my eyes, sir? Okay, sir. So place hands about 2 feet apart lateral to patient's ear. Slowly move the wiggling fingers and both hands along the imaginary ball until the patient identifies them. Then ask the client to tell you when the moving object is first spotted. So, sir, say a word if you spotted the moving object, sir. Okay? So,
Yes. 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 Yes.
okay, thank you. So, now I'll be proceeding, checking your eyes if it is aligned and symmetrical. So, as I can see, it is aligned and symmetrical. I will be inspecting the eyebrows, sir, for your hair distribution and the alignment and skin quality and movement. So, your eyebrow, sir, is evenly distributed and slightly arched. So, can you raise your eyebrows, sir? Okay, thank you. Can you down your eyebrows, sir? Okay, thank you. So, I'll be inspecting the eyelashes for evenness of distribution and direction of curve. So your eyelash is both evenly distributed and curls are slightly upward. So, I'll be inspecting the eyelids for surface characteristics, skin quality and texture, position in relation to the cornea, ability to blink, and frequency of blinking. Inspecting the lower eyelids when the client's eyes are closed. So, sir, okay, so it closed symmetrically and no discolorations and no lesions. And now, ma'am, sir, can you blink for me, please? Okay, thank you. So now I'll be inspecting the area over the lacrimal gland and lacrimal sac for swelling. So I'm just going to palpate, sir. Okay, thank you. So now I'll be asking the patient to look up. Depress the lower lid of the patient with one's thumbs afterwards to assess the sclera and the bulbar conjunctiva. Okay, ma'am. Okay, sir. Can you look up? Okay, thank you. So, everted the eyelid to assist the pulmonary conjunctiva. Okay. Okay, thank you. So, now I'll be inspecting your eyes, iris and pupil, sir. Just look up straight into my eyes, sir. Okay, thank you. So, I'll be inspecting each cornea and lens for opacities, clarity, and texture. So, I will shine a pen light from the side toward the eye or shine a pen light to an oblique angle to the eye and move the light slightly across the corneal surface. Ask the client to look straight ahead while doing so. So, just look up straight to me, sir. So, there is no opacities. So, sir, I'm gonna shine my pen light into your eyes to check your direct and consensual reaction of your pupil. Okay. Okay, thank you. So what I did, sir, is I show light in your right eye and then it constricted, and that is direct reaction. And then for consensual, it means when it's shown in light up in your right eye and left eye also constricted, which is normal. So now is to assess the each pupil's reaction to accommodation. So held an object, a pen light or pencil, about 10 cm from the bridge of the client's nose. Ask the client to look first at the top of the object and then at the distance object, and behind the pen light instructed the patient to alternate the gaze from the near to the far object. Observe the pupil response. So, sir, can you look at the top of the pen light, sir? And at the back, sir? And the pen light again, sir? And the at back? Okay, thank you. So, ask the client to look at the near object, then move the pen light or pencil toward the client's nose. So, just look at the near object, sir, and then I'll just move the pen light, sir. Okay, thank you. So now we're assessing the ocular alignment arising from the extraocular muscle. So from about 2 feet directly in front of the patient, shine a light into the patient's eye and ask the patient to look at it and inspect for the reflections in the corneas. Look for direct and consensual reaction. Okay, sir? Okay, thank you. So assess the extraocular movements, looking for normal conjugate movement of the eyes in each direction or any deviation from normal nystagmus, lag, and convergence. So stood to 2 to 3 feet in front of the patient. Ask the patient to follow the examiner's fingers or pencil while making a wide edge in the air. So look for the jerky movements of the nystagmus on lateral gaze and on upward gaze. And then watch for a rim of sclera between the upper lid and iris as the eye move up and down. So I'll be performing the cardinal Fields gaze, sir. So I need you to follow the tip of my pen light with your eyes only. Do not move your neck, just the eyes only. Okay, sir? Okay. So now I'll be assessing the test of testing the convergence. So I'll be testing where you can simply just follow the pen. Okay, so ask the patient to look at the examiner's finger as the examiner moves it toward the bridge of the nose. Then check for the eye convergence. So, sir, can you look at the pen light, sir? Okay, thank you. So now, sir, I'll be summing up everything that we've covered. So for your visual acuity, when you were reading the Snellen chart, the result is of your right eye vision is 20/25. Then your left eye is 20/50, and then both of your eyes is 20/30. Then for the visual field, when wiggling my fingers, so your upward field is at 50 degrees, your downward is 50, and also your nasal is 50 degrees, which is normal for the inspection of the eyes. The eyes are aligned and symmetrical, your eyebrows are evenly distributed and your eyelashes are evenly curled upward, and for the eyelids, the skin is intact, the eyelids is symmetrically, no discharge and discoloration, and you have a normal blinking, which is 50 to 20 blink per minute. And so, as I'm palpating for your lacrimal gland, and there is no edema, there is no swelling and no thinning of the sclera, and your color of your sclera is white, which is normal, and your bulbar conjunctiva is good, your pupil and your iris is normal, no opacities, and then the pupil is at 3 millimeters, which is normal, so your pupil reaction to accommodation is normal. So the cardinal field gaze test is both eyes are coordinate and no jerky movement, everything is normal. So now I'll just give an advice, ma'am, that you need to minimize your exposure to you need to minimize your exposure to cell phone. So do you have any concerns and clarifications?
No.
So thank you very much, sir, for your cooperation. Have a good day. Take care. Then I'll just remove my gloves and discard it. Then I'll just perform hand hygiene. Document findings in the client record using the printed or electronic forms or checklist supplemented by a narrative notes when appropriate.